I've got Mr. Cardew ready on the couch for you, Dr. Field.
Thank you, nurse. So, the main thing that is troubling you, Mr. Cardew, is this irritating rash in your groin, is it?
Yes, Doctor. Came up quite suddenly and the itch is terrible. You can't sleep at night.
And scratching, of course, makes it worse. Yes, you've got a lot of inflammation here on the inner thighs and round the scrotum. Now, let me have a look at your feet. No, don't move, all right.
Oh, I've always had a bit of athlete's foot there, Doctor.
Yes. And your hands? Ah, yes. Tiny blisters. Do they itch?
Yes, but nothing like the groin.
Scalpel, please, nurse.
Here you are.
What are you going to do?
Oh, it's all right. I just want to scrape some of the scales off and look at them under the microscope. A slide, please, nurse.
Here.
Thank you. Hold it steady. There. Now, put a few drops of potassium hydroxide on it, please.
Yes.
Thank you. All right, Mr. Cardew, you get dressed and I'll have a word with you later.
Thank you, Doctor.
Let me help you.
Oh, yes, nurse. I'll put my shoes
Now then, I think we'll have these patches off, Mrs. Fletcher, and see what it is you are allergic to.
Yes.
A nurse, please. Number 1, negative. Number 2, no reaction. Number 3, oh, look, nurse. Hyperemia and vesiculation, a very definite positive.
Oh, yes.
Now, which one is that?
Number 3, rubber.
Well, Mrs. Fletcher, you are obviously very hypersensitive to rubber.
Well, I never. And I've always been so careful to use rubber gloves for doing the washing up.
Yes, well, you'll have to stop that. And you'll have to be careful with brassiers and suspenders and things like that, too. Now, I'll write to your doctor and suggest some ointment for him to prescribe for you to help your present contact dermatitis to settle down.
Thank you, Doctor.
All right.
Goodbye.
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 I think I'll do my letters now, nurse. Oh, and would you get the laboratory for me, please?
Yes, Dr. Field. Here's your dictating machine.
Thank you. Right. Now, dear Dr. Dwyer, your patient, Mr. Cardew's presenting complaint is pruritus and formication of the groin and scrotum, but he also confesses to itching and scaling between the toes and irritating blisters on his hands. In the groin there is an intensely erythematous rash with raised edges and secondary excoriations due to scratching. Scrapings show fungal mycelium under the microscope, and I am sending specimens for culture. He has the typical findings of tinea pedis between his toes and epidermophytides on his hands. I suggest a course of systemic griseofulvin and the use of multifungin topically. You might like to use multifungin H initially to give him some immediate relief from the intense itching. Yours sincerely. Yes, nurse?
Your call to the path lab, sir.
Oh, thank you. Hello, Dr. Field here. Yeah, I wonder, have you got the results for Mrs. Henshaw through yet? Yeah, it was for serum lipids, blood cholesterol, protein-bound iodine, and liver function tests. You have? Oh, good. No, could you send them through to St. Mary's ward for me, please? I'll be up there for a ward round in about half an hour. Thank you very much. Goodbye. Now then, Mrs. Fletcher's doctor is, let's have a look. Here, it's Harrison. Dear Dr. Harrison, patch tests on Mrs. Fletcher show that her dermatitis venenata is due to hypersensitivity to rubber. I have advised her accordingly and would suggest a simple steroid cream for her and future avoidance of contact with rubber and rubberized materials. Yours sincerely. Oh, answer that, please, nurse.
Outpatients department, Dr. Field's clinic. Oh, yes, hold on. Dr. Field, the house physician would like a word with you.
All right. Hello, Field here. Yes? Yes? How old did you say? Well, that sounds like a drug reaction, doesn't it? An exfoliative dermatitis. Yes, I'll be up in the wards quite shortly. I'll certainly have a look at him. Right, goodbye. Now, anything else, nurse?
Oh, a letter about Mr. Whiting.
Oh, yes. Dear Dr. Manley, I'm afraid Mr. Whiting's psoriasis has not responded very well to topical treatment with coal tar and salicylic acid, and the hyperkeratosis is, if anything, rather worse. I think we would be justified in trying a course of occlusive steroid therapy, and I will arrange this at the clinic for him, yours sincerely.
Tea, sir.
Oh, thank you, yes. Then I really must go to the wards.
And would you like some milk and sugar or...
Hello, sister.
Oh, good morning, Dr. Field.
Morning.
The laboratory have just sent this up for you.
Oh, thank you. But let's see Mrs. Bonham first.
Oh, certainly. Dr. Field to see you, Mrs. Bonham.
Oh, hello, Dr. Field.
Hello, Mrs. Bonham.
It's much better, I think.
Ah, good.
Kidney dish, please, nurse. And bring a trolley with the fresh dressings.
Oh, yes, that has improved. Secondary infection cleared up, necrosis resolved. I think carry on with Iruxol dressings for another couple of days, sister, to complete the debridement, and then we can get Mrs. Bonham back on her feet with suitable supportive bandaging, of course.
Very good, Dr. Field. Your leg is doing very well, dear.
Thank you, Doctor. Goodbye.
Goodbye.
Will I be going home soon?
In a few days, I think, Mrs. Bonham.
Sister,
Yes, Dr. Field?
the HP rang me up about a case...
Oh, yes, over here. A case of renal failure and pyelonephritis, who started a skin eruption this morning.
A case of iatrogenic dermatosis, perhaps. Oh, and then there's Mrs. Henschel with the ichthyosis. You know, I think she might be an interesting case to show at one of the Royal Society of Medicine meetings. Still, let's go and see your renal failure patient first.
Disease of the skin is called dermatosis. Repeat, dermatosis. The specialist in dermatosis is a dermatologist. Repeat, dermatologist. And his subject is called dermatology. The adjective is dermatological. Repeat, dermatology, dermatological. If skin is discolored by disease, the lesion is called a macule. Repeat, macule. Reddening of the skin which disappears on pressure is called erythema. Fading on pressure can be demonstrated by diascopy. The rash of measles, Masern, is an erythematous macular rash. Repeat, erythema, erythematous, or erythematous. Other macular eruptions are purpura, roseola, rubella. Repeat, purpura, roseola, rubella. A lesion that is raised above the level of healthy skin is a papule. Papular rashes may be seen in lichen planus or xanthomatosis. Repeat, lichen planus, xanthomatosis. A raised flat lesion is called a plaque. For instance, localized scleroderma. A larger papule becomes a nodule or a tubercle or a tumour. Repeat, nodule, tubercle, tumour. A tumour may be sessile. Repeat, sessile, or pedunculated. The papules seen in urticaria or nettle rash are called wheals, but the Americans call them hives. Blisters or vesicles are seen in herpes, in varicella, and in dermatitis herpetiformis. Repeat, herpes, herpetiformis, varicella. Large blisters are bully. Pemphigus is a bullous rash. Vesicles that are filled with pus are called pustules. Pustules are seen in Psychosis barbae or in variola, the smallpox. Repeat, pemphigus, pustule, psychosis. Superficial infection of the epidermis by pyogenic bacteria, repeat, pyogenic bacteria, is called impetigo. Repeat, impetigo. If another primary skin disease, for instance eczema, becomes secondarily infected, the lesion is impetigonized. Repeat, impetigonized eczema. Infection of a hair follicle can cause a boil or furuncle. Repeat, boil, furuncle. Furuncles and carbuncles are usually caused by staphylococcal infection. Infected lesions are often weeping or exudative. Dried exudate forms crusts or scabs. Repeat, exudate, exudative. But flakes of skin due to exfoliation are scales, not scabs. Scaling is seen in psoriasis and in other hyperkeratotic diseases. Repeat, psoriasis, hyperkeratotic. Itching of the skin is called pruritus. Repeat, pruritus. Scratching a pruritic lesion may cause excoriations. Repeat, excoriation. Excoriations due to pruritus can become impetigonized. Pruritus is a prominent feature in scabies, in neurodermatitis, and in urticaria. The irritation of urticaria and other allergic dermatoses usually responds well to topical treatment with Zoventol. Cracks in the skin are called fissures. When there is actual loss of skin substances, ulcers are formed. For instance, rodent ulcer or gravitational ulcer, or in gangrene. Repeat, gangrene. Healing of ulcers or other skin lesions may result in formation of a scar or cicatrix. Excessive scar formation results in keloids. Repeat, cicatrix, keloid. Spots and rashes are often described by their shape. For instance, circinate or gyrate, linear or serpiginous. Repeat, circinate, gyrate, linear, serpiginous. Distribution of lesions is important. Lesions may be solitary or grouped or generalized, and individual spots can be discrete or confluent. Repeat, discrete, confluent.